So the story again, we will start about June. She is 8 years old, Labrador female, 70 kgs. This patient was presented to me on August 16th. She developed exfoliate superficial pyoderma around 4 years before. The skin lesions were continuously there on her body. She was not my original patient. She went to several doctors to resolve this infection, and she continued. The owner continued giving Apoquel, and there was marginal improvement with Apoquel. She also gave some hypoallergenic food, but there was no actual result. The clinical signs and symptoms, there are severe erosions and symmetrical bilateral ventral lesions on the eyes, dorsal, nasal, planum, and concave and convex ear pinnae were also affected. There was alopecia all over the body with crust with middle of dorsal nasal planum. Like here, this place, there was crust, and there was severe pruritus. The dog used to itch a lot. Now you can see these are the regions which are there on this part. Blood tests, what we did is IgE, then cortisol, just to rule out the Cushing disease. Thyroid panel was done. The glucose level was for the metabolic disorders, and for allergies, eosinophils were also measured. Now this was the blood work. Here, most of these reports were normal. Here the IgE was 157. So the immunoglobulin IgE level was on a higher side, and cortisol level was very on the lower side. This was the only difference what we got from this blood test. Our diagnosis was, for me, I diagnosed it as a pemphigus foliaceus, but again, there were a lot of differential diagnosis, but now we'll come about it, we'll discuss about later. Now, diagnostic tools which were used was cytology was done, tape preparation was done, then biopsy and histopathology and fine needle aspiration was not done, and PCR also was not done, which I think we should have was required for this in certain cases, because that the facilities were not there simply. So now, after going from here, I think that is an additional information to me that this has to be done very much for such type of cases. Someone had asked me about the Woods lamp. This was the Woods lamp. What is I was using for this. So therefore, I had. It is having TW80 is the name of this. It's for pet skin fungus Woods lamp that I had got in my recent visit to China, and that is really doing good work for me. But I think the conventional one is better than this, because that gives much better results than such kinds of wood lamps. But for it is very easy, portable to use, so I prefer to use this. It's easy to use it for my patients. This is my dermatoscope. Using this, I can see a lot of hairs and everything. So the injection, I started giving prednisolone as an injection. Then I started giving some total plus for this deworming, the celebactin spot on. I did lime sulfur medicated bath for resolving this infection. And medications which was prescribed was cyclosporin, ketoconazole, and prednisone. But in spite of giving this, the lesions were not coming down. Then I added vitamin E supplement, thinking that these lesions will reduce. And for the nodular lesions which were there, I gave this is a cream which has got clotrimazole. Now this is the post-treatment lesions. With this, you can say the lesions are reduced, but also I should tell you that I gave cytopoint injection because the itching was not going down in spite of giving prednisone. So after giving cytopoint injection, the itching immediately came down and this dog started feeling better. And this is the before and after photographs of this same dog. And when I was sitting here, I just texted June today, how is June? And she said she is fine with recovery.
That's cute. So what was your ultimate diagnosis? I know you said the primary, secondary differentials. So what do you think was, I mean, I know that there was some tests they couldn't do, but what's your working diagnosis in this case?
I think it is some immune disorders which is there and some allergic issues which were there with her. And after controlling the immunity, giving vitamin E and supplements and resolving the allergic issues, giving cytopoint, I think she has started recovering. But one more thing is there are certain nodules which are there, which are still there, they are not resolving completely. I need to know, all the itching is reduced, but there are certain nodules there are on the skin, on the which were there for around 3-4 years. They are still there.
So what diagnostically would you ideally do in this dog? Because there's actually quite a few things those lesions could be, but what would you ideally do for your next diagnostic step?
I think we should go for this FNA and the biopsy.
Yep. Yeah, I would definitely biopsy because to me that could be lots of things, right? Especially when you did your treatment and we had, there was immunomodulatory / there was an antifungal in there. So this could be some sort of weird deep fungal, this could be pemphigus. Cyclosporin, remember ketoconazole will increase your level of cyclosporin, which is probably why you use them together. So you're inherently treating inflammation and a potential infection at the same time. What I'll warn you about is if you start treatment, and I've had to do this before too, if an owner for cost reasons can't biopsy, and I just have to kind of treat and cover and do my best to provide quality of life, and then let's say all of a sudden a month or two later they do want to biopsy, when you have improved lesions, your biopsies could not be as remarkable. So ideally in these cases, I will wean, if they do biopsy, I'll wean them off medications and essentially you're almost letting your lesions come back because you don't want to biopsy and not have it provide answers. So that's just my ideal situation. I would start weaning this dog off drugs, forewarn the owner, lesions might come back, but that's when I would biopsy them so I get an answer of how to treat this dog long term. Because even if it has allergies, that the cytopoint sounds like it did help. I mean, it's a breed that definitely could have allergies. Allergies should not cause those facial lesions. So this would be another situation like we were talking about earlier where this dog could have multiple diseases at the same time.
Yeah.
Great.
Thank you.
Yeah, any other questions? We still have one more case? Do you still have a case? Yeah?